Are you on Social Security or Medicare? Then stop what you are doing right now, because there is money sitting out there with your name on it. Real money, government money. Money that has already been set aside specifically for seniors like you. And the vast majority of people who qualify for it have absolutely no idea it exists. That is not an accident. These programs are not advertised. They do not send you a check in the mail automatically. Nobody calls you and says, "Hey, you qualify for this, here is your money." You have to know what to ask for. You have to know where to look, and you have to do it before the window closes. That window closes on June 1st. Here is what makes this so painful. The seniors missing out on these payouts are not doing anything wrong. They are not lazy. They are not careless. They are simply not being told. The programs exist. The money is real, but the information is buried under complicated government language that most people never get through. We are cutting through all of that today. The numbers are staggering. Millions of seniors across America are leaving hundreds to thousands of dollars on the table every single year. Money tied directly to Social Security and Medicare. Money built into programs you already paid into your entire working life. According to the National Council on Aging, an estimated 2 to 3 million seniors who qualify for just one of these programs never apply. That is billions of dollars in unclaimed benefits going untouched every single year. And here is what makes 2026 different. There have been real changes this year. New adjustments, new thresholds, new eligibility rules that actually make it easier for more seniors to qualify than ever before. Some people who did not qualify last year qualify right now in 2026. Today, I am going to walk you through every single payout available to you before June 1st. No confusing language, no government jargon, just plain, clear information that could put real money back in your pocket starting this month. Stay until the very end, because the last program I am going to cover is the biggest one. Most people who qualify for it have never heard of it. It can save you thousands of dollars a year, and it takes less than 10 minutes to apply for. You do not want to miss that one. Let's get into it right now. Let's start with the one that saves seniors the most money the fastest. It is called Extra Help. And if you are on Medicare and you are paying for prescription drugs every month, this program could change everything about what you are spending. Here is what Extra Help actually does. Right now, millions of seniors are paying full price or close to full price for their medications every single month. Some are choosing between their prescriptions and their groceries. Some are cutting pills in half to stretch them further. And many of them qualify for a federal program that would drop those costs dramatically. They just do not know it exists. Extra Help is a federal program connected directly to Medicare Part D. It is designed to cover your prescription drug costs if your income falls below a certain level. And in 2026, the income limits are higher than most people think. If you are single and your income is up to $23,475 a year, you may qualify. If you are married, your combined income can be up to $31,725 a year. Those numbers are higher than many seniors assume, which is exactly why so many people never apply. Here is what the program actually pays for. It covers your Part D premium. It drops your drug deductible to zero. And it caps every single prescription copay. In 2026, you will pay no more than $5.10 for generic drugs and no more than $12.65 for brand-name drugs. And once your out-of-pocket drug costs hit $2,100 for the year, every covered prescription is completely free for the rest of that year. The Social Security Administration estimates Extra Help is worth $5,700 per person per year. Some estimates put it even higher at $6,200. And here is the part that should make every senior angry. According to government data, roughly 2 to 3 million people who qualify for this program right now have never applied. That is billions of dollars in prescription savings going unclaimed every single year. Not because people do not need it, because nobody told them it was there. There is one more thing you need to know. Extra Help is not retroactive. If you qualify today and you do not apply until next year, you do not get reimbursed for the months you missed. That money is gone. That is why June 1st matters. Every month you wait is a month of savings you will never get back. To apply, you go directly to ssa.gov or call Social Security at 1-800-772-1213. It is free. It does not affect your other benefits, and it could save you thousands of dollars this year alone. Now let's talk about the program that can stop money from being taken directly out of your Social Security check every single month. It is called a Medicare Savings Program. And if you do not know about this one, you need to hear every word of what I am about to say. Here is what is happening to millions of seniors right now without them realizing it. Every month, Medicare Part B takes a premium directly out of your Social Security payment before it ever reaches you. In 2026, that premium is $202.90 every single month. That is over $2,400 a year coming straight off the top of your Social Security check before you see a single dollar. Medicare savings programs exist specifically to stop that from happening. There are three main programs, and each one covers a different income level. The first is called QMB. That stands for Qualified Medicare Beneficiary. This is the most powerful one. If you qualify for QMB, the program pays your Part B premium completely. It also covers your Part A premium if you have one, your deductibles, your copayments, and your coinsurance. That means no premiums, no deductibles, no copays for Medicare-covered services. None. And providers are legally prohibited from billing you for Medicare cost sharing when you have QMB. If they try, you have the right to dispute that bill. The second program is called SLMB. That stands for Specified Low-Income Medicare Beneficiary. SLMB covers your Part B premium. That is $202.90 back in your pocket every single month. Over $2,400 a year that stops coming out of your Social Security check. The third is called QI, Qualifying Individual. It also covers your Part B premium and is available to people with slightly higher incomes. But this one is first come, first served. Funding is limited, which is another reason why applying before June 1st matters so much. Here is the thing that shocks most people when they find out. The income limits for these programs are higher than most seniors expect, and some states have even more generous rules than the federal minimums. You may qualify and have no idea. And when you enroll in any Medicare savings program, something else happens automatically. You are instantly enrolled in extra help for your prescription drugs too. Two benefits. One application. Apply through your state Medicaid office or call 1-800-Medicare to find out how to get started in your state. It is free to apply. And for many seniors, this one program alone puts over $2,000 a year back into their hands. This next one is something most seniors assume they already have handled. But many do not. And it is costing them every single month. In 2026, Social Security issued a 2.8% cost of living adjustment. That is a real increase. For the average recipient, that means about $56 more per month added to their benefit. For some, it is more. For some, it is less. But here is the problem. Not every senior is actually seeing that full increase in their pocket. Here is why. When Social Security goes up, Medicare Part B premiums can go up at the same time. And for many seniors, those higher Medicare premiums are being deducted from the same check that got the increase. So the raise they were expecting gets eaten up before they ever see it. But there is a protection built into the law called the hold harmless provision. This rule says that your net Social Security payment cannot go down because of a Medicare premium increase. Your take-home amount is protected, but this protection only applies automatically to certain beneficiaries, and some people who should be protected are not getting it correctly applied to their account. If your Social Security payment did not go up in January 2026 or went up by less than you expected, do not just assume that is how it is. That is your signal to call Social Security directly and ask them to review your account. Call 1-800-772-1213. Ask specifically about your 2026 COLA adjustment and whether the hold harmless provision is being applied to your account correctly. This call costs you nothing. And if there is an error, fixing it means more money in your check every single month going forward. Do not leave that on the table. This next program is one of the most underused benefit programs in the entire Social Security system. And it is wide open right now in 2026. It is called Supplemental Security Income, SSI. And if you are 65 or older and your income and savings are below a certain level, you may be able to add this to what you are already receiving from Social Security. Many seniors assume SSI is only for people who never worked or who are on disability. That is not true. If you are 65 or older and your monthly income is low enough and your savings and assets fall below the limit, you can qualify for SSI even if you are already receiving regular Social Security retirement benefits. In 2026, SSI pays up to $967 a month for an individual and up to $1,450 a month for a couple. That is real money added on top of what you are already getting, and here is what makes this even more valuable. When you receive SSI in most states, you automatically qualify for Medicaid. That means additional health coverage on top of your Medicare. It means more of your medical costs covered. It means less coming out of your pocket every time you see a doctor. The income and asset limits are strict, but they are also often misunderstood. For example, your home does not count as an asset for SSI eligibility. Your car generally does not count, and the first $20 of most income is not counted either. Many seniors who assume they do not qualify actually do when someone walks them through the real numbers. If you are not sure whether you qualify, go to ssa.gov or call 1-800-772-1213 and ask them to screen you for SSI eligibility. It takes one phone call, and for seniors who do qualify, it can be one of the biggest financial changes of their retirement. And now we have reached the one I told you to stay for. This is the program that almost no one is talking about, but it has already helped thousands of seniors add hundreds of dollars a month to what they are receiving. And most people who qualify have never heard of it. It is called the Medicare Savings Program QI Enrollment Deadline. And specifically in 2026, the funding for this program resets and applications are processed on a first-come, first-served basis. Once the funding for the year runs out, new applicants have to wait. But that is not the only deadline pressure right now. If you are enrolled in Medicare and you have not had your full benefit eligibility reviewed in the last 12 months, June 1st is a critical window. Here is why. Many seniors are enrolled in Medicare plans that made sense when they first signed up but no longer match their current income, their current health needs, or the programs they now qualify for. And because these programs are not reviewed automatically, people stay in the wrong situation for years. A benefits review is free. It is done through your state health insurance assistance program, known as SHIP. Every state has one. SHIP counselors are trained, certified, and completely free to use. They will sit down with you and go through every single program you may qualify for. Extra help, Medicare Savings Programs, SSI, state-specific programs that go even beyond what we have covered today, and they will help you apply for everything you are entitled to. According to benefits data, the average senior who goes through a full SHIP benefits review walks away enrolled in programs worth $1,500 to $4,000 per year that they were not receiving before. That is not a small number. That is real money. Money that covers groceries. That covers medications. That covers utility bills. Money that makes retirement feel less like survival and more like living. To find your local SHIP counselor, call 1-800-MEDICARE or go to shiphelp.org. It is free. It is confidential. And the only thing required is one phone call. Let's bring it all together. Because I want you to walk away from this video with 5 things you can act on today. Number 1, apply for extra help if you are on Medicare and paying for prescription drugs. If your income is under $23,475 a year as a single person, you may qualify. It is worth up to $5,700 a year and it is not retroactive. Go to ssa.gov or call 1-800-772-1213. Number 2, look into Medicare savings programs. QMB, SLMB, and QI can stop your Part B premium from coming out of your Social Security check. That is up to $2,400 a year back in your hands. Apply through your state Medicaid office. Number 3, call Social Security and ask about your 2026 COLA adjustment. If your payment did not go up the way you expected, ask about the hold harmless provision and request a review. Call 1-800-772-1213. Number 4, ask Social Security to screen you for SSI eligibility. Even if you already receive retirement benefits, you may qualify for additional income. Do not assume. Ask. Your home and car generally do not count against you. Number 5, call SHIP for a free benefits review. Go to shiphelp.org or call 1-800-MEDICARE. A trained counselor will find every program you qualify for and help you apply. This one call has been worth thousands of dollars a year for seniors who took it. Here is the bottom line. This money exists. It is real. It is already set aside for people in exactly your situation. The only question is whether you claim it before someone else's application takes the limited spots, before June 1st arrives, and before another year passes with money on the table that belongs to you. Share this video with every senior you know, a parent, a neighbor, a friend from church, someone in your community. One conversation about these 5 programs could change someone's entire retirement. If this helped you, please subscribe to this channel and turn on the bell. Because these programs change every year. Income limits go up. New benefits get added. Deadlines shift. What I cover here is always current and always free. The seniors who stay subscribed stay ahead. And staying ahead means keeping what is yours. Thank you for watching. Go make that call. And I will see you in the next one.